This is my head to toe rubric. It's completely blank, no notes, no nothing. It's going to remain face down for the video. Hi, my name's Taylor. I'm going to be your SPSU student nurse today. I am going to be completing your head to toe assessment, but before I begin, can I just get your name and date of birth?
Jordan, April 26, 2005.
Perfect. And do you know where you're currently at?
SPSU.
Yep. And do you know what year it is?
2025.
Perfect. So you are a no times 3, which means I'm comfortable moving forward. So I am just going to grab a general health history from you, okay? So do you have any past or current diagnoses I should be aware of?
No.
Any past surgeries?
No.
Any pertinent family history?
No.
Any medications? This includes over-the-counter, herbal, supplements, vitamins?
No.
Any allergies?
No.
Okay. And how's your diet?
I eat 3 times a day.
Okay. And what's that usually consist of?
Taco salad, chicken salad.
Stuff like just a bunch of salads? Okay, perfect. Do you exercise at all?
Just walking.
Just walking? Okay. Do you drink at all?
No.
How about smoking? This includes marijuana, vaping, e-cigarettes, stuff like that?
No.
Okay. Are you incontinent at all, which basically means you can't hold your bladder or your bowel movements and you have accidents on yourself?
No.
Okay. And how's your pain today?
No pain.
Okay. And on a scale of 0 to 10, how would you rate it? 10 being the worst, 0 being none at all?
0.
Okay, perfect. I do feel comfortable moving on. I am just going to grab your vitals, okay? I am going to start with your blood pressure. Do you have a preferred arm?
No.
Okay, perfect. And how's your blood pressure normally? Is it high, low, normal?
Normal range.
Perfect, sorry. Okay. And keep it like that. Okay. So I am just going to feel for that brachial artery. Perfect. Okay. And this is just going to squeeze your arm a little bit, okay? Perfect. Your blood pressure was 118 over 78, which is in normal range. So I'm not worried about your blood pressure at all. Next, I'm just going to get your pulse. Okay, so can I just have your arm for me? Perfect. And I am just going to take your radial pulse. Perfect. Okay, and I'm just going to take that for a full minute, okay? Okay, perfect. So I did get a pulse of 70 and a respiratory rate of 16. I did count your respiratory rate for the last 30 seconds of that. We do that because we don't want you knowing when we're counting your breaths, because when you know we're counting, you tend to change how you breathe, and we don't want that. Okay, next I'm just going to take your temperature. If I had a thermometer, I'd do it that way. So I'm just going to have to feel your face. You don't feel warm at all. You're not flushed. You're not sweating. So I can probably conclude that your temperature is about 98.6, which is normal. It's what we want. Next, I am just going to take your O2 oxygen level, but since I don't have a pulse ox, I can't. But I am just going to check for signs of clubbings, which was what I would do if before I would put your pulse ox on, and I'm not noticing anything. I'm also just going to check your cap refill. I want this under 3 seconds, and it is symmetrical, which is what I want. So I can probably conclude that you're probably around a 96 to 100% with oxygen, which is normal, and that's what we want. Okay, so now I am just going to move up to your arms. So can I just have you lift these up for me? Perfect. So I am just inspecting your arms. I notice your color's good even throughout. Your temperature's fine. I am noticing some moles and stuff. Is that normal for you?
Yeah.
No issues with any of that?
No.
Okay, perfect. I am just going to check your muscle tone. Perfect. That is symmetrical, which is what we want. Next, I am just going to check your range of motion and your strength. First, I'm just going to check your cranial nerve 11, which is your spinal accessory. What I'm going to do is just put my hands here and have you shrug. Perfect. Any pain? Perfect. Can I just have you look side to side for me? Perfect. So I can say that cranial nerve 11 is intact. Next, I am just going to palpate your pulses, okay? So I am just going to check your radial arteries for your pulses. Those are strong and symmetrical, which is what we want. And next, I'm just going to check your brachial arteries for your pulses. And those are nice and symmetrical, just like we want. Okay. Now I'm just going to check the strength in your hands, okay? So what I'm going to have you do is squeeze my hands for me. Good, that's nice and symmetrical. I'm going to have you keep them here. I'm going to push in, you push out. I'm going to have you push in, I'm going to push out. Good, I'm going to have you flip them this way. I'm going to push up, you push down. Perfect. I'm going to flip them that way, and I'm going to push in, you push up. Perfect. Any pain with any of that?
No.
Okay, great. Next, I'm just going to check for crepidness. Can you swim? Perfect. So I'm just going to put my hand here and have you do a front stroke forward and then back. Perfect. I'm not noticing anything abnormal there. And do that for this side too. Perfect. I'm not noticing anything abnormal there, so I'm not worried about it. Okay. Next, I'm just going to move up to your head, okay? So I'm just looking at your face. Again, your color looks normal. Your face looks symmetrical. I'm not worried about it. So I am just going to move on to your head real quick. Can I just have you take your hair down for me?
Yeah.
Perfect. So I am just going to look at your scalp. I'm just looking for any signs of moles, scars, lesions, anything like that, but I'm not noticing anything. Check on this side. Good. I'm not noticing anything abnormal, which is good. I am just going to check your occipital lymph node back here. That's non-palpable, which is what we want. Next, I'm just going to feel your head. You just let me know if it hurts, okay? Any pain or tenderness with any of that?
No.
Okay, perfect. You can put your hair up if you'd like. Okay. Next, I'm just going to do some cranial nerves with your face, okay? So I'm going to first do cranial nerve 5, which is your trigeminal nerve. What I'm going to have you do is just close your eyes. I'm going to put my pen light on your face, and you just tell me where you feel it, okay?
Left cheek, right cheek, chin, forehead, nose.
Perfect. And this also is used for eating, so I'm just going to put my hands under your jaw and have you clench. Perfect. I'll have you open and close it a couple times. Perfect. Any pain with any of that?
No.
Okay, perfect. So your cranial nerve 5 is intact. Now I'm just going to do your cranial nerve 7, which is your facial nerve. I'm just going to have you make some faces for me, okay? Can I have you smile? Can I have you frown? Can I have you puff up your cheeks? And can I have you raise your eyebrows? Perfect. So your cranial nerve 7 is intact. Okay. Now I'm just going to move on to your eyes, okay? So I'm just going to pull your eyelids down and look in. Can you look up for me? Perfect. Now I'm going to pull them up. You look down. Perfect. So what I was looking at was the sclera, which is the white part of your eyes. I was just making sure it was white, and it is. If it was yellow, I'd be worried about liver problems, but since it isn't, I'm not. I was also looking at your conjunctiva, which was nice and pink, so I'm not worried about that. Okay, do you have any light sensitivity I should know about? Okay, perfect. So I'm just going to do a corneal light reflex, okay? So I'm just going to shine a light on the tip of your nose and watch it reflect in both eyes, okay? Perfect. More time. Perfect. Okay, and your eyes constricted with the light, which is what I wanted. They were symmetrical. Okay, now I'm just going to test cranial nerve 3, which is your ocular motor nerve, okay? So I am just going to shine the light in your eye again, okay? I'm just checking for pupil constriction and dilation. Can you just look at me? Perfect. Perfect. And they did constrict, which is and dilate. So now I'm just going to have you look at the tip of my pen and then my hand, and I'm just checking for accommodation of distance, okay? So can you look at the tip of my pen? Can you look at my hand? Can you look at the tip of my pen and my hand? Perfect. So your eyes did accommodate with distance, which means your eyes are perla. Just means that your pupils are equal, round, and reactive to light, and they accommodate, okay? Okay. Next, I'm just going to test your cranial nerves 3, 4, and 6, which is your ocular motor, your trochlear, and your abducens. Okay, so I'm just going to have you follow my pen light, okay? And this is called the 6 cardinal gaze of field. The 6 cardinal fields of gaze. Perfect. So I can conclude that cranial nerves 3, 4, and 6 are intact. Okay. So next, I'm just gonna move on to your nose. Okay. Do you have any food allergies I should be aware of?
No.
Okay. So we're gonna test your cranial nerve 1, which is your olfactory nerve. This is just a smell test. So I'm just gonna have you close your eyes. I'm just gonna have you smell something for me and just let me know what it is. Okay. And what was that?
That's coffee.
Perfect. So I can confirm that cranial nerve 1 is intact. Okay. Next, I'm just going to look in your nose, okay? So if I'm going to have you lift your head up for me. So what I'm looking for is to just see if your mucosal lining's pink, which it is, which is good. I'm not noticing any signs of polyps or anything. I'm not noticing any deviations in your septum, and your turbinates are present, which is what we want. Okay. Next, I am just going to move on to your ears, okay? So I am just going to feel your pinna and work my way down. Any pain with that?
No.
Okay, perfect. Now I'm just going to look at your ears, okay? So I am just going to look behind. I'm looking for any redness or dryness, which I'm not seeing. I'm also just going to pull your pinna up and back and look inside your ear. Perfect. I'm not seeing anything abnormal, no redness, no swelling. Again, just same thing. I'm looking behind your ear for any redness or dryness, and then I'm going to pull your pinna up and back and look inside your ear. Perfect. So I'm not noticing anything abnormal there. Your ears are symmetrical and aligned, which is good. So I'm not worried about any of that. So now we're just gonna move on to your mouth, okay? I am looking at your lips. They are symmetrical. I'm not noticing any blueness around your lips, so I'm not worried about lack of oxygen. Okay, so I'm just gonna take a quick look in your mouth, okay? So if you could just open up for me. Perfect. Your tongue looks symmetrical. Your tonsils don't look like there's any problem with those. Your mucosal lining's nice and pink. Can I just see your teeth and gums? Perfect. Your gums look healthy and your teeth look good. Do you go to the dentist often?
Yeah.
How often?
Every 6 months.
Perfect. Any pain with your teeth or mouth?
No.
Okay, perfect. So now I'm just going to test cranial nerve number 12. This is your hypoglossal nerve. So I'm just going to have you stick your tongue out and move it side to side for me. Perfect. So cranial nerve number 12 is intact. Now I'm just going to test cranial nerve 9 and 10, which is your glossopharyngeal nerve and your vagus nerve. What I'm looking for is your soft palate and uvula to rise up and back with phonation when I have you say ah. This will also let me know if you have a gag reflex, but don't worry, I'm not going to gag you, okay? So I'm going to have you open your mouth for me, stick out your tongue, and say ah. Perfect. So I did note that your uvula and soft palate did go up and back with phonation, which is what we want. So I can say that cranial nerve 9 and 10 are intact for you there. Okay, so now I am just going to move on to your neck. Okay, so I am looking at your color. It looks normal. There's nothing abnormal there. I do notice some a mole, but you say those are normal. Okay, perfect. Now I'm just going to check for your tracheal alignment, okay? Perfect. So it was aligned, so I'm not worried about it, okay? Next, I am just going to check your carotid arteries, and I'm just going to check for any bruits, which means there are any signs of abnormal blood flow, okay? So I am just going to listen with my bell. I'm just going to have you hold your breath when I place it, okay? Perfect. No signs of bruits. Perfect. No signs of bruits. Okay. And now I'm just gonna palpate them, just make sure they're strong and symmetrical on both sides, okay? Good. Okay, and just this side. Okay. Now I'm just gonna check the remaining of your lymph nodes, okay? I've already done your occipital, so now I'm just gonna do your post-auricular, your pre-auricular, your submandibulars, or submental. I'm gonna do your cervical chain. Perfect. And I'm gonna have you lift your shoulders up and in for me. And I am just gonna feel for your supraclavicular. Perfect. And then I'm just gonna check your skin turgor here, okay? I'm just noticing, I'm gonna see if I can notice any signs of tenting, which I don't. This just is a sign of dehydration, okay? Perfect. So now, do you have any problems with your thyroid I should be aware of?
No.
Okay, perfect. So I am just gonna palpate your thyroid, okay? So I'm just gonna have you turn this way for me. Okay. Are you okay if I put my hands on your neck?
Yes.
Okay, perfect. So I'm just gonna have you look up for me. I'm just gonna find the notch here. I'm just gonna go over and I'm just gonna feel that.
Mm-hmm.
Perfect. And now I'm just gonna displace your trachea. This shouldn't hurt, but I'm just gonna see if your thyroid's enlarged, okay? So I'm just gonna push and you're gonna swallow, okay? So swallow, perfect, and swallow. Perfect. So I'm not worried about any enlargement of your thyroid. I didn't notice any nodes or anything, so I'm okay with that. Now we're just gonna move on to your respiratory, okay? So I'm just gonna have you face the wall. Perfect. Are you okay if I untie this?
Yeah.
Okay. And are you okay if I undo this?
Yeah.
Okay, perfect. Okay. So I am just looking at your back. Your skin color looks good. Your temperature feels normal. I do notice that you have some acne. Is that normal?
Yeah.
Okay, perfect. Do you have any history or anything of scoliosis or anything in your family?
No.
Okay, perfect. So I am just looking at your spine and it is midline and straight, which is what we want, so I'm not worried about that. I'm also looking at your AP ratio. It's 2-to-1, so I'm not worried about barrel chest or anything. Now I'm just gonna check your chest wall and lung expansion, okay? So I'm just gonna put my hands on your back and have you take a deep breath in for me. Perfect, and just one more time. Perfect, so that was symmetrical, which is what we wanted. Now I'm just gonna listen to your heart or your lung sounds, okay? I am just gonna listen for 12 different spots. I'm gonna have you take a deep breath in and out every time I put my stethoscope on your back. If you need a break, you just let me know, okay? Okay. So I'm just gonna have you flex your back for me for a second. I am gonna follow this crescent moon shape, and I am just gonna go above your scapula for the first one. Okay. Take a deep breath in. Perfect. Okay, one more. Perfect. Okay, do you need a break at all?
No.
Okay, perfect. And last one. Perfect. So your lung sounds were clear and equal on both sides, which is what we want. Next, I'm just going to percuss your lung sounds. I'm just listening for any signs of resonance. This is what it's going to feel like. And it's just going to be on the same 12 spots that I did when I listened, okay? resonance was noted, which is what we wanted. Okay, I am just going to do this back up for you. And I am just going to have you lay down because we're going to begin your cardiac assessment portion. I'm just going to have you cover up. Perfect. The first thing I'm going to check is for jugular vein distension, so I am just going to take away your pillow. Okay. So what I'm going to have you do is just look at me and hold your breath. Perfect. And then look that way and hold your breath. Perfect. So I did notice that your jugular vein was pulsating, but it wasn't distended at all. If it was, I would raise you up 45 degrees and reassess, okay? But it wasn't, so I'm not worried about it. Do you want your pillow back?
No.
Okay. Next, I'm just going to listen to your heart sounds, okay? Are you okay if I take this down?
Yeah.
Okay, perfect. Perfect. So I am just going to listen to 5 heart sounds, okay? I'm listening for murmurs and lub-dub, okay? And I am going to just count off, okay? So with my diaphragm engaged, I am going to listen to your aortic valve first, which is in your second intercostal space on your right side, okay? So clavicle, space, rib 1, space, rib 2, space, okay? So I'm just going to listen to your aortic valve. Perfect, those lub-dubs I'm hearing. So I'm just going to hold my spot, engage my bell, and listen for any signs of murmurs, okay? Perfect, and no murmurs are being noted, so I'm going to move on, okay? Next, I'm going to listen to your pulmonic valve, which is in your second intercostal space on your left, okay? So clavicle, space, rib 1, space, rib 2, space. With my diaphragm's engaged, so I'm just going to listen for those lub-dubs. Perfect, those are being heard. So I am just going to hold my spot, engage my bell, and listen for any signs of murmurs, okay? Perfect, and no murmurs are being noted, okay? So now I'm just going to listen to your Erb's point. This is technically not a valve, but it is where I'll hear your heart the loudest, okay? And this is in your third intercostal space, okay? So clavicle, space, rib 1, space, rib 2, space, rib 3, space. So my diaphragm's engaged, so I'm going to listen for that lub-dub. Perfect, I'm hearing that, so I'm just going to hold my spot and engage my bell to listen for any murmurs, okay? Perfect, and no murmurs are being noted, okay? So now I'm going to listen to your tricuspid valve, okay? This is in your fourth intercostal space, okay? So clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space. So my diaphragm is engaged, and I'm just going to listen for those lub-dubs, okay? Perfect, I'm hearing those, so I'm just going to hold my spot, engage my bell, and listen for any signs of murmurs, okay? Okay, perfect. I'm not hearing any sounds of murmurs, so I am going to go on to your last valve, which is your mitral valve, okay? And this is in your fifth intercostal space, mid-clavicular, okay? So clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space. I am just going to meet under, okay? Rib 5. Here's your space here. I am going to go mid-clavicular, so I am just going to meet my finger about here. My diaphragm is engaged, so I am just going to listen for those lub-dubs, okay? Perfect. I am hearing those lub-dubs, and now I'm just going to take your apical pulse for a full minute. This is where you'll get the most accurate pulse number, okay? perfect. And I got 68 for that apical pulse, okay? And now I'm just gonna hold that spot and listen for any signs of murmurs, okay?
Okay.
I'm just gonna engage my bell, place that back here. Perfect, and I'm not hearing any signs of murmurs, okay? Perfect. So we are gonna move on. I am just gonna go onto your abdomen next, okay? So I'm gonna have you put this back on. Would you like your pillow back now?
Sure. Okay.
Here you are. I will keep your legs covered, and I am just gonna raise this. Is that okay?
Perfect.
Perfect. And I am just gonna have you lower your pants and underwear without revealing anything, okay? Perfect. Perfect. The first thing I'm going to do is just inspect your abdomen, okay? So what I'm looking for is symmetry. I'm just making sure I don't see any protrusions, any hernias, any lumps, or any bumps or anything, which I'm not seeing. I am noting that you just have a couple stretch marks, but those are normal, so I'm not too worried about those. When was your last bowel movement?
This morning.
This morning, okay, but no issues with that? You weren't constipated or anything like that? Diarrhea?
No.
Okay, perfect. The next thing I'm going to do is I'm just going to look at your abdominal aortic pulse, okay? So what I'm going to do is I'm just going to have you hold your breath, and I'm going to look at that, okay? I'm going to have you hold your breath for me. Perfect. I see it pulsating. And now I'm just going to have you do it one more time. I'm just going to have you hold your breath for me. Perfect. I do see it pulsating. Okay. The next thing I'm going to do is I am just going to listen to your bowel sounds, okay? What I'm listening for is just gurgles. I just want to see how your bowel's moving, okay? So first, my diaphragm is engaged, and I am just going to start in your right lower quadrant, okay? Perfect. And I do hear 5 gurgles, so now I'm just going to move up to your right upper quadrant, okay? Perfect. And I hear those 5 gurgles, so now I'm going to move to your left upper quadrant, okay? Okay, and I definitely hear those gurgles, so now I'm just going to move to your left lower quadrant, okay? And I definitely heard those gurgles. Okay, and I heard all 5 gurgles in each quadrant, which is what we want, so there's nothing abnormal about that. Next, I'm just going to listen to your abdominal arteries for any signs of bruits. Again, that's just that abnormal blood flow that we don't want to hear, okay? So I'm just going to engage my bell. And first, I'm just going to do your abdominal aortic, okay, artery. So I'm just going to go from your xiphoid process to from your belly button, just meet in the middle, okay? And I'm just going to listen for any signs of bruits. Okay, I'm not hearing any signs of bruits here, so I'm just going to move to your right renal artery, okay? I am just going to hold my spot here, and I am just going to move down, okay? Okay, and I'm not hearing any bruits there, so I am just going to move back up to your aorta and go to your left renal artery, okay? Perfect, and I'm not noting any bruits here, okay? So now I'm just going to go down to your left iliac artery, okay? And this is just above your iliac crest. Perfect. I'm not noting any bruise, so now I'm just going to move to your right side. Again, just above that iliac crest. Perfect. And I'm not hearing any bruise there. So now I'm just gonna percuss your stomach, okay? Basically, it's that tapping again, and what I want to listen for is tympani, okay? And I'm just gonna start in your right lower quadrant and just work my way around. Perfect. And I did hear that tympani, which is what we want to hear. If I didn't hear that, I'd be concerned of like a mass or something. Next, I'm just gonna check for your the border of your liver. I just want to make sure it's not enlarged or anything. So I'm just going to do the same tapping up from your right lower quadrant all the way up to I hear the dullness of your liver, okay? So I'm going to start your right lower and just move my way up until I hear dull. Okay, and I do hear the dullness here, which is about right where your rib cage starts, which is normal because your liver usually hides behind it, so there's no enlargement or anything, so I'm not worried. Okay, next I'm just going to move on. I am just going to feel for around your stomach, okay? I'm going to just do light palpations first, and then we're going to move on from there, okay? So I am just going to, when I'm doing this is I am just looking for any masses or anything, any lesions, any hernias, any bumps or anything. I'm also noting your face after I just finished. I didn't see any pain or grimacing. Did that hurt at all?
No.
Okay, perfect. So I am just going to do it deeper now, okay? Perfect, and I didn't feel anything abnormal there, which is good. And that just that completes our abdominal assessment, okay? So I'm just gonna cover you up now. Now we're just gonna move on to the legs, okay? Are you okay if I uncover you?
Yeah.
Perfect. Okay. So now I'm just looking at the legs. The color looks good even throughout. I'm just gonna feel your temperature. Feels good, nothing abnormal there. I'm not noticing any swelling or anything, so which would concern me with edema. I am going to check for pitting edema though. Okay, so I'm not concerned about pitting edema because if your leg didn't dimple, if it did, I would be worried about that. I do notice that you have a bruise here. Where'd you get that?
Oh, that's just a bug bite. That's healing.
Okay, and you didn't have any like bad reaction to that that bug bite at all, did you?
No.
Okay, perfect. Okay, so now I'm just gonna inspect your arteries, or I'm gonna inspect your pulses, okay? The first thing I want to do is I'm just gonna check your femoral arteries, okay? And then I am gonna listen to these for bruise as well, okay? Are you okay if I just stick my hand in your pants a little bit?
Yeah.
Okay, first I'm just gonna check for symmetry, okay? So I'm just gonna have you bring your legs up as a butterfly. Perfect. And I'm just gonna reach my hands down here. Perfect, and my fingers are right here. Perfect, those are strong and symmetrical. So now I'm just gonna check for any signs of bruise in them, okay? So I'm just gonna have you bring one leg towards me like a frog. Okay, I am just gonna put my stethoscope in real quick and engage my bell. Perfect. And again, I'm just gonna feel and listen, okay? Okay, so my fingers are right here. Okay, I am just gonna stick my stethoscope in and listen for any signs of bruise, okay? Okay, and my stethoscope is right here. And I'm not hearing any signs of bruise on this side, so now we'll go on to the other side if you want to just switch legs. Perfect. Again, I'm just going to feel and listen, okay? Okay, and my finger is right here. Okay, and again, just going to take a quick listen for any bruise, okay? Okay, and my stethoscope is right here. Okay, and I'm not hearing any signs of bruise in there. Perfect. Next, I'm just going to check your pulses. Are you okay with taking your socks off, or do you want me to do it?
I can do it.
Perfect. So the first one I'm going to check is your popliteal. So I'm just going to have you lift your legs up a little bit. Perfect. I'm just going to make sure they're strong and symmetrical. Perfect, they are. So now I'm going to move on to your posterior tibialis, which is down here by your ankles. Good, and those are strong and symmetrical. Next, I'm just going to check your dorsalis pedis pulse, okay? Good, and those are strong and symmetrical, which is what we want. While I'm down here, I'm just going to check your toes cap refill. Again, I just want these under 3 seconds and symmetrical, which they are. I am just looking for any signs of redness or anything between your toes. I'm also just going to take a quick look at the bottom of your feet. If you can bend them for me, perfect. I'm not noticing any dryness or cracking. Again, the same thing. No dryness or cracking, and I don't see any abnormal moles or anything. Perfect. Now we're just going to move on to the sharp and dull test. Have you ever done a sharp and dull test before?
Yes.
Okay, perfect. So we're just going to do a sharp and dull test. I'm going to give you a reference. This is dull. This is sharp, okay? I'm just going to have you close your eyes and tell me where you feel that, okay?
Right thigh, that's dull. Left thigh, that's sharp. Right knee, that's sharp. Left knee, that's dull. Right shin, that's sharp. Left shin, that's sharp.
Okay, and last two.
Right foot, that's dull. Left foot's dull.
Perfect. So I'm not worried about any peripheral neuropathy, which just means you lose a sensation in your legs and lower extremities. You lose nerve function there. Okay, so now I'm just going to have you sit up for me and swing your legs over. I am going to tie it down, but don't get up. Perfect. Next, I'm just going to check the strength and range of motion in your legs, okay? So I'm just going to have you push up on your legs. Perfect. Now we're going to do the same thing we did with your hands. I'm going to push in, you push out. You push in, I push out. I'm going to push up, down, you push up. And I'm going to push up, you push down. Perfect. Any pain with any of that?
No.
Okay, perfect. Next, I'm just going to check your patellar reflex, okay? So I'm just going to have you close your eyes, and we're just going to see if you have a reaction or not, okay? Okay, I did notice a little reaction. Now we're just going to go on the next side and do the same thing. I'm just going to have you close your eyes for me. Okay, one more time. Close your eyes. Okay, I didn't notice that big of a reaction there, which is fine. Before we perform your Romberg test, which is just a balance test, I'm going to perform a cerebellar function test, which just tests your coordination, okay? So I'm just going to have you go like this, and I'm just going to have you flip back and forth really fast. Perfect. And I want to have you make an okay sign, tap each finger to your thumb, and go back and forth as fast as you can. Perfect. And now I'm just going to have you touch your nose and then my pen light, and I'm going to move it, okay? So touch your nose, pen light, nose, pen light, nose, pen light. Good. So I'm not worried about your coordination at all. So now we're just going to perform the Romberg test before I feel comfortable walking you, which is our gait test. So if I can just have you put your socks and shoes on, do you need any help with any of that?
No.
Okay, perfect. And I'm just going to put your shoes right here within reach for you. Perfect. And now I'm just going to have you stand up. I'm going to have you stand shoulder width apart, not leaning on anything. So I'm going to have you step forward just a little. Perfect. Not leaning, arms out. Okay. And I'm just going to have you stand there with your eyes closed for 10 seconds. Okay. Okay, perfect. So I noticed no swaying. I didn't see you rocking at all, so I'm not worried about your balance. So I feel comfortable doing the gait test. What I'm gonna have you do is just walk to the door as a normal pace, and then walk back heel to toe. And I'm gonna be right beside you the whole time while you do it, okay? So walk to the door. Perfect. And then heel to toe for me. Perfect. I'm just gonna have you sit down. Perfect. Okay, and before we end our assessment, I am just going to give you your Braden scale score. This is just your risk for getting a pressure ulcer injury. I am going to give you 23, which is our highest score, which means you are at no risk. I'm comfortable giving you this assessment because you're mobile, you can walk, you eat a good diet, you exercise, and you're not incontinent on yourself, and I'm not worried about friction or shear or anything like that. So that concludes our assessment. Thank you.